living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Online services offer different options to make healthcare easier and more accessible, but many patients find going online for telehealth or patient portals confusing. Welcome to Healthy Living for Life. I'm your host, Janet Whitmoyer, and today we'll be breaking down the benefits of telehealth and patient portals and discuss how they can make your life easier. Stay tuned.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome back to Healthy Living for Life. Today we're joined by Dr. Jonathan Griffin, who is the Chief Medical Innovation Officer for St. Peter's Health. And thank you, Dr. Griffin, for being with us today. What I want to start off with is just the basic. What is telehealth?
Telehealth, it means many things. It's connecting with your provider or care team when you're not face-to-face. So, traditionally we think about using the telephone. That certainly is encompassed within telehealth, but now we are using lots of different audio-visual platforms, similar to the one that we're using right now to create this recording. Oh. This is a way to virtually connect to providers with patients.
Okay. So can you tell me, are telehealth and telemedicine the same thing?
It's when you start talking about differences between telehealth and telemedicine, you really start splitting hairs. Okay. It really means the same set of tools and devices and technology platforms that are used to make those connections with patients. And so telehealth and telemedicine really do mean the same thing, at least to me they do. We call this suite of services at St. Peter's virtual services. And it's definitely a growing area of the services that we offer.
Okay, all right. So can you tell me what are the different types of services patients can get using telehealth care?
Yes. It's interesting how we're seeing virtual care or telehealth being used. Of course, patients are able to connect with providers now virtually and on demand. MD Live, Teledoc. There are big companies out there now offering immediate care through an application on somebody's phone, for instance. So that's one way that people are using telehealth. But many healthcare organizations, similar to St. Peter's, are now using telehealth to connect primary care providers or behavioral health specialists. We have lots of specialty physicians and providers using telehealth. Our care managers are doing outreach to patients using telehealth. We've got occupational and physical therapists using it. Our cardiac rehabilitation program has a lot of virtual components to it now.
Okay.
We've put telehealth on with our ambulances, in fact, and are now starting to use that for folks even before they get to the hospital when calling the ambulance. We've got telehealth set up in all of our skilled nursing facilities in the community, as well as all of the assisted living facilities in our community. And there's a growing number of community sites where we're embedding telehealth services. And then on the inpatients, on the hospital side, our hospital team of providers are actually using telehealth to connect with subspecialists in other areas. So burn care, intensive unit care, stroke care, acute neurology care. Those are all examples of connections that we're creating with other healthcare organizations to bring those experts to right here to Helena, Montana. So it's being used in a diverse variety of ways, and we continue to see a lot of creativity and ingenuity advancing this technology.
Okay, so what would you say are the major benefits of patients who utilize the telehealth services?
Sure. So one would be at least a convenience factor. Mm-hmm. Of course, we'll talk about some of the challenges. I know when people are getting signed on, there's a learning curve. And of course, using the technology always seems to fail. But despite those challenges, it does increase a convenience factor for folks if there are long travel times to a provider, or if there are other difficulties that would be barriers for people to having face-to-face visits with their provider. So it extends the reach of our care teams, in fact, and allows us to connect with people who are further away. The other advantage is that it creates additional touch points with patients. So having a mix of face-to-face as well as virtual access options creates better connected care. And the other cool part is that providers work with other providers. So it connects people together in new ways, and so it's able to bring expertise that we wouldn't have otherwise had access to. So there's a lot of benefits with telehealth as we move forward, and excited to see those possibilities.
Okay, so we've talked about a lot of the benefits. When should someone forego or think about going to see a patient or a provider face-to-face rather than using telehealth?
Sure. Well, just using good sense, there are visits that are appropriate for a face-to-face visit, and more serious conditions, more worrisome symptoms, more severe symptoms would prompt me to encourage patients to seek a face-to-face visit or urgent care or emergency department. So in those kinds of scenarios, it's appropriate. But we do see telehealth being used as a way to gauge whether folks need to go to the hospital or not. And so oftentimes, if providers sense that something is amiss and that they're worried that something significant is going on, they will direct patients to a higher level of care if they deem that appropriate. And so, it's got its place. It's not for all things. And obviously, we'll have to continue doing all of the hands-on type of care that we've continually offered. We won't see that replaced by telehealth, of course, but just new ways and different ways to connect.
Okay, we need to take a quick break, but when we come back, we'll be talking more with Dr. Griffin about overcoming the challenges of patient portals, so stay tuned.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Welcome back. We're with Dr. Jonathan Griffin at St. Peter's Health talking about online healthcare services. And Dr. Griffin, I know a big one is patient portals. So again, can you start off with a quick definition of what a patient portal is?
You bet. A patient portal is a website or phone application that people use to access their health records, get results, request or schedule appointments, send messages to and from their care teams. There are several variations of patient portals, and it really depends on the health information systems being used by the hospitals and clinics that patients visit.
Okay, so can you tell us how patients actually get in and access the portal?
You bet. Typically, when a patient originally registers with a clinic or a hospital system, there's a process that occurs where information about the patient is collected. Oftentimes, an email address is requested from the patient, and that then triggers an application process that the patient will have to walk through online to get things signed up and set up correctly for them to access their portal. And typically, hospitals and clinics will have support staff and information available for patients to help walk them through that process, because sometimes that can be confusing.
Yeah, that's great information and good to have that support. So once a patient gets into the portal, what can they actually do while they're in there?
It really does depend on the portal. There's quite a variation in functionality between different patient portals. But typical things are looking at your past health records, looking at new test or lab results that are becoming available when folks are seeking care. Oftentimes there's messaging functionality that allows patients to send their care teams and providers messages and receive messages back. There are some systems that are that allow patients to schedule appointments. And there are even some systems that allow patients to launch into telehealth visits directly from the patient portal. But again, there is a wide variation in different portals that are being used out there.
Okay, so you've kind of touched on this a little bit, but what are the benefits that patients get from using the portal?
You bet. It's more direct access to their information. Mm-hmm. That's probably the biggest benefit, which then allows patients to become more informed about what's going on with their health interactions, with their providers, with their care teams, and also just a be more engaged with their health. So I think that that's a major benefit. But then there's the convenience, depending on the functions that are available in the portal. Rather than having to call and wait on hold, you're able to schedule an appointment online. And then, of course, the ease of even launching directly into those virtual or telehealth visits. Those are major benefits that hopefully, ease access for folks to their information as well as to their care teams.
Okay. I know that there are concerns by some people about security and privacy in the portals. Can you help us confirm that portals are in fact secure and private for folks that are listening?
Yes, indeed. And so healthcare providers and our health information systems are really held to a higher standard, or a very high standard. There are to the highest of standards, I should say, that of privacy and security requirements. It's one thing that's required by the law. We are audited on our ability to maintain these privacy and security standards. So this is something that we look at very closely and increasingly invest in. Of course, whenever you're dealing with online services of any sort, there's always an element of risk, and we continually evaluate those risks and continually build the right barriers and security, as well as our processes to protect health information.
Okay. And I know a lot of times when people go to the doctor or the hospital, they want to have a family member have access to the information. How does that work in the portal system?
Right. This scenario depends on the relationship of patients to one another. So if a patient has someone who is making medical decisions on their behalf, then there's a more direct access to patient portal. But for family members, for instance, that are involved and want to be involved and have been given permission to be involved in a patient's care, then there are ways to interconnect to create access points for those family members. So, and it again depends on the system, but there are mechanisms for family members to be involved with their loved one's care and have access to a designated set of information, because teenagers, for instance, don't want their parents to see all their information. And so there are restrictions. It's actually quite complicated, but there's ways of connecting people, and there's ways of also protecting information that folks want to keep private.
Okay. In the last 30 seconds, can you tell me what people should do or can do if they have questions about online services, and what are their resources for getting more information about portals?
The best route is going to be to contact your primary care team. They're the quarterback of your care, and they will point you in the right direction and get you the right information to get signed up on the portal.
Okay, great. Thanks so much, Dr. Griffin, for this great information. We have to take another break, but when we come back, we'll learn about a crusade that's going on to help older adults get more tech savvy and how they can learn to use patient portals. So stay tuned, we'll be right back.
Montanans are independent. We're also responsible, protective, and committed to our families and communities. That's why we've done so well against COVID-19. As we open up, we've got to keep doing what we do best. And it starts with each and every one of us, protecting public health in the 406 for our families, friends, and neighbors. We all have to do our part. Montanans get that. And we've got this.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, Call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Welcome back. Crystal Morse and Gloria Fewer join us now to talk about how setting up a patient portal, how easy setting up a patient portal really can be. Thanks, ladies, for joining us. So I'd like to start off with you, Crystal. I know the two of you had worked to set up a program to help older folks better understand patient portals. Can you give us a high-level look at what you two did to get the program started?
Sure. Well, it really happened organically. Gloria is part of our Patient Family Advisory Council for Mountain Pacific, which is one of our newest initiatives, is involving the patient voice and the perspective to our team. With the help of her and the other advisors, they've really challenged us and shaped our work into what's we try to focus on as patient care, patient-centered care. So some of the discussions on patient portals that we had as a council focused on the efficiency and the convenience without having to play phone tag with your doctor. Okay. And so the group was really commenting about what a time saver it was to enter into the portal, being able to look at their data almost like it was real time and being able to request an appointment, medication refills. And Gloria was quick to say, I just don't get into the portal and really never tried. And it was really the words that caught my attention was from her, electronics scare me. And that changed our way of thinking. And from there, it was obvious that if someone like Gloria, who is very active in her community and extremely smart, if she didn't know how to enter the portal, then I didn't think her peers would either.
Okay. So Gloria, turning to you, why was this project something that you wanted to be part of?
Well, it helps older folks to take charge of their own health care. We need to be involved. And this is especially important in today's world with the surge of telehealth, patient portals, and AARP. The internet can help. It's our life, and we need to be aware of our own health care options.
Okay. So why do you think your efforts helped people become more confident in the use of technology?
Well, the internet is scary to many older people. But I'm 90, and if I can do it, so can others. When someone walked me through it, it was easy. I just feel I need to be an example.
Oh, awesome. Crystal, I wanted to turn back to you. What did you learn was the biggest barrier for most of the people when it came to patient portals, and how did you help them to overcome those barriers?
Well, the biggest barrier that we saw was them feeling helpless and helping them overcome that fear of breaking the computer. They honestly were scared to even touch a button and not being able to reverse it and lose everything that they had on their computer. So it was really with the partnership of AARP that we made electronics fun and them wanting to learn more. So we partnered with AARP, the senior centers, hospitals, and clinics to provide that one-on-one tutoring of how to enter portals. And we really showed them how to enter and the steps to get in and navigate the tools once inside.
Okay. So once a person gets in there and learns how to navigate and figure it out, do you recommend that they have family members also get involved in setting up and viewing the patient information?
Yes, absolutely. Allowing families and caregivers to have access was a feature that we demonstrated as we went along. We showed the participants how to upload their care directives. We explained the advantages of having loved ones to view their information. And families can retrieve the labs, immunizations, medications, and notes from all the visits. So we also found that it saved travel time, and those that acted on behalf of loved ones were in different geographical areas. And so it was a huge bonus for that. It also gave families the opportunity to be involved in their health and serve as a link to their healthcare professionals if they needed to be.
Okay, awesome. So the next question is for both of you, but Gloria, I'm going to let you start on the answer, and then Crystal, you can chime in. What do you think is the most important, why is it most important for older folks to overcome their fears and concerns related to the patient portals?
Well, as we get older, health issues seem to be more numerous and more serious, so we need to be aware as aware as we can about those issues. The patient portal gives us written information from the results, your health history, and it includes immunizations and more.
Okay. Crystal?
Well, right now, portals are more vital than ever, especially with the emergence of telehealth and telemedicine. It's really important that we don't leave our seniors behind, or I do believe there will be a surge in hospitalizations. So we need to empower those seniors to take charge of their health care now, and they just need the guidance on how to.
Okay. And I have one final question for both of you. What advice would you have, we'll start with you, Gloria, again, for how people can become more confident when learning how to use and navigate in a portal and using the technologies?
Well, young people are very knowledgeable about all kinds of devices and the internet. Most are willing to share. So our senior center and our ARP invited high school students into the senior center to help us with technology. They answered questions. They helped us to figure things out, and on the laptops or their phones or their tablets, whatever they had, and it was rewarding for both sides.
Okay. Crystal, just a few seconds, what would be your parting thoughts on that?
I would just say don't be afraid. Learn how to do it. Don't let anything or anyone intimidate you by that, and just have fun with it.
Great advice. And I'd like to thank both you, Crystal and Gloria, for being on our show today, and also thanks to Dr. Griffin for sharing his information. And thanks to all of you for tuning in. And until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.